50 million people suffer from epilepsy. Depression haunts and hurts 150 million people. Almost 3,000 people commit suicide every day. In low and middle income countries, 75% of people do not get the mental health services they need. To reduce this huge gap, WHO developed the Mental Health Gap Action Programme, or mhGAP, in 2008. An epilepsy project in rural China integrated a simple model of epilepsy control into local health systems and achieved excellent results.
We trained mainly the doctors working in the county and township level. So we have to educate them first. And also we have the public education for the people, let them to know what is epilepsy.
话说白了就是没有经济来源收入，要供养的娃子上大学的呢，就是两个人奋斗。也就话说回来，这属于说打3天睡1天，并不烦得起的很。01年吃这个药，吃上相当好，在这个吃的药这个基础上，家庭一日好一点，也能出个做生意了。我就说是没吃药之前呢，我总干啥都不敢走。
The trial project that started in 6 provinces has now been extended to 15 provinces, and tens of thousands of epilepsy sufferers have been treated. Georgia and Cameroon are now also training primary care physicians on how to diagnose and treat patients with epilepsy. mhGAP, scaling up services for mental, neurological and substance use disorders. Services like the Cape Mental Health Project in Cape Town, South Africa, which offers care for children with intellectual disabilities.
We provide training in basic, call it basic physiotherapy, seating, positioning, feeding the children. That can be put in place. Those are skills that can be acquired.
This is my daughter Tara. She's intellectually disabled. When I started working with the cerebral palsy children, you just have kind of a bond. Each child responds differently, but if you know how to bond with that child, it's just beautiful. It just all comes together and you will know exactly what to do exactly at the right time.
mhGAP, tackling priority conditions like alcoholism, child mental health disorders, dementia, depression, drug abuse, epilepsy, psychosis, suicide.
In India particularly, following the failure in exams, almost 2,300 students commit suicide. So we have taken this as an issue, and we are very happy to say that the Tamil Nadu government has made a new rule in which a student who has failed in the 12th exam can write the failed subjects within 1 month after the results so that he doesn't lose a year.
Low-cost suicide prevention programs like Sneha's are now being initiated in other parts of India, China and Sri Lanka. The Schizophrenia Research Foundation, or SCARF, is also based in Chennai in South India. A WHO collaborating centre, SCARF provides care for a range of chronic mental disorders.
I think we eminently fit into this pattern of a low resource setting, working towards delivering mental health care to just about everybody who comes within our fold. We have developed a rehabilitation strategy which is fairly tailor-made for each person. The focus could be on training of social skills. How do you get into the bus? How do you buy a ticket? How do you go to the bank? How do you draw your money? Or it could be on getting a job.
My name is Suresh. I'm working as a manager in a public limited company in the Department of Quality Assurance. My case manager, she maintains my records. I tell her about my problems. She discusses with the doctor and they give me some medicine. And I'm normal now. Thanks to my doctors.
mhGAP, establishing productive partnerships, reinforcing commitments with existing partners, attracting and energising new partners. WHO's goal is to see that mental health is integrated into primary healthcare systems across the world. We have the knowledge. Our major challenge now is to translate this into action and to reach those most in need. We need to change policy, practice and political perspectives. Governments across the world need to see this as a health priority. The cost of providing basic care for these priority conditions is as low as $2 per person per year in low-income countries.
It's not about the money first, it's about the commitment, the love, the compassion, the will to make a difference. And I think it's the belief that you can make a difference.
1 in 4 people will be affected by a mental, neurological and substance use disorder at some point in their life. These stories clearly show that with proper care, assistance and medication, millions can be treated.
My desire is that every Indian should be able to go somewhere close to his home and get mental health care.
They didn't ask to be here, they didn't ask to be like this, so they can't say, I need your help, so I'm giving my help to them in the best way that I can.
好了，也就是说基本上恢复的好了，这心里确实就是说这个月是相当好的，这就是。
There is no health without mental health.